Hello, welcome back. I'm Leah, and today we're going to do a continuation of the story that I started 2 videos ago, where we were talking about my interaction with the medical system and how that has not been ideal. I was having these weird symptoms. They went completely unheeded by my doctor because of the way that events went. I'm just sort of like probably permanently disabled. The story that I want to tell today actually involves someone other than me. Because of that, I'm just treading lightly around how much detail I'm giving. To put you in the timeline, what's happening is that we're basically at the thick of seizures. I haven't yet been assessed from my sleep study. So in 2022, this is when my partner and I get COVID. And we had been really lucky. We got through 2 full years. We never got COVID. It isn't severe because we're fully vaccinated at the time. I think January. So like 6 months later, my partner gets and is treated for a condition called diverticulitis. Diverticulitis is a very dangerous condition that happens for reasons that we don't quite understand. Diverticulitis can't happen without what are called diverticulae. We have our digestive system. First, we have the stomach, and then we have the intestines that kind of do this, the small intestines, and then we have the large intestine where the waste basically is kept until it leaves our body. That large intestine can also be called the colon, it can be called the bowel, but it's basically where we store our poop. Like the small intestine, the large intestine is a really stretchy organ. Basically, if you think of a balloon in the package, it hasn't been inflated, anything like that, it looks pretty small. But then when you actually put air in it, it can expand a lot. And if you were to fill that balloon with air really, really full and then let the air out and then do that again a few times, you'll start seeing a little bit of some areas that are getting a bit thin or a little bit wrinkly. And that's just because when you stretch something out a lot of times, it'll sort of have certain areas that are less strong than others, and it'll have little pockets maybe that develop. And that's sort of what happens as we age with our colon. About 70% of people over the age of 50 have diverticulae, which is the name for these little pockets that happen in your large intestine or bowel or colon or whatever you want to call it. So lots of people have no issue. They'll sort of go through their life, no problem. They'll have these little pockets, but they're fine. They don't really cause issues. When you do get an issue is when something maybe gets stuck in one of those pockets, or something causes any kind of abrasion or anything in one of those pockets, and you can actually have a tear. And that tear will kind of mean that bacteria can get into the wall of your large intestine. It's a significant problem when you have any kind of tear or perforation in the inside wall, because bacteria can get in, cause an infection in the lining of your large intestine. But it's an even bigger problem if for some reason that tear or perforation extends to the point that it breaks the outside wall and now you have waste spilling into your abdominal cavity. That's when we start talking about words like sepsis. So that's a very, very, very big problem. My partner went in because he had symptoms for diverticulitis. The way that they treated it was they took a scan to see what the situation was. They said, okay, we can pump you full of intravenous antibiotics. After a few days, we'll take another scan, see if it looks good. If it looks good, then we'll send you home with some oral antibiotics and it'll clear up on its own. And you might have some discomfort for the next few months, but it'll clear up on its own. Basically, when in hospital, the two main things they're doing is they're trying to keep the infection at bay and resolve the infection. And the other thing, because I haven't really mentioned this, diverticulitis is wildly painful. Like, it is so painful. I've spoken to people who have had both kidney stones and diverticulitis, and they're like, oh, no, the kidney stones were nothing compared to diverticulitis. So it's like a 10 on 10 in pain. Basically, you're in hospital hopped up on painkillers. They're pumping you full of intravenous antibiotics because that's all they can do to, one, keep you alive, and two, keep you comfortable. And so it's not a good time. It wasn't great that he was experiencing this. You know, we were concerned. We were like very much trying to support him and trying to hope for the best and everything. And he did have a full recovery. He hasn't had it return or anything because it can return. We were really happy that he had this positive outcome after he had been diagnosed with this really painful disease. He was in the hospital, I want to say about 4 days. His white blood cells started looking great. They took another scan, saw that the problem had mostly resolved. The rest, they were going to just have him at home taking antibiotics, and they sent him home. So I had like a bit of a roadmap for what a hospitalization could look like because my partner had just had one. this was January of 2023. We had been hearing this really odd statement that diverticulitis was an old people disease. We were hearing that from like the nurses and doctors and stuff, mostly the doctors. And he found that really odd because this would have been in 2023. He was 37 years old. I suppose literal children think that's old, but I don't think most people, when they say someone is old, they're thinking of a 37-year-old. The interesting thing was that when he was in the hospital, he had a roommate, and his roommate also had diverticulitis, and his roommate was like 25. And so we were really confused by this statement that we were hearing that like diverticulitis is an old people disease. And we think maybe it's because they kind of expect people to have these pockets in their large intestine as they age, because it's just sort of normal from the stretching and contracting of your large intestine. And so we thought, oh, okay, maybe it's just that like it can happen to anyone, but it happens most often to older people. And so we tried not to think too much of it. And we certainly had not in any way connected it to having COVID. So fast forward about a year. I've broken my ankle in April of 2023. Now we're in April of 2024, and I'm at home and I'm having massive discomfort. It's on the lower left-hand side of your abdomen, right by your pelvis. If you have a uterus, you probably have an ovary in that neighborhood. I was having a lot of discomfort, and my partner was very concerned because that is where your large intestine lives. He had had a similar kind of pain when he had had his diverticulitis. We'd gone to the doctor and we had said, hey, like I'm having this pain. And to her credit, she was a lot more attentive than she had been. And she said, oh, okay. Like, I mean, that could be a couple of things. It could be that you're having like referred pain from a UTI or something. But if it's not that, it could be something quite serious called diverticulitis. And so what we're going to do is we're going to put you on antibiotics. And if it doesn't at least start to improve in the next like 24 to 48 hours, you should go to the hospital, because it's probably diverticulitis, and that really, you need to go to the hospital to treat that. Long story short, we go to the emergency room. And the nice thing about this part of the story is I can give all the detail I want because it's my business. And I explained and I said, you know, my partner had this a year ago, and he says it sounds a lot like what he experienced, and he had diverticulitis. The Ontario healthcare system has been completely gutted in the past couple of years. I could do a whole video series just on like how infuriating it is to watch these like wonderfully well-meaning, hardworking healthcare workers try to do literally anything with the wildly limited resources they have. One thing I will say, I know that, you know, doctors can be hit or miss, but I have nothing but kindness for nurses. The people who are working day to day with the patients are a goddamn delight. I don't want this story to be about, oh my God, healthcare workers are awful. I think like the people who are really on the front lines dealing day to day with the patients, they need to be celebrated and appreciated enough that they have the resources to properly do their job. It's a difficult situation for everyone involved, I think is what I'm trying to say. So I did go to the emergency room. So at that point I was able to get, for example, some pain medication that was stronger than Tylenol. I was able to have my blood work taken. I was able to get an IV catheter put in my arm so that they could start giving me intravenous antibiotics, because they had tested my blood and they were like, oh, she has way too many white blood cells going on. And then eventually they were able to give me a CAT scan, a CT scan, to determine what was happening. And I did have diverticulitis. And then I spoke to a doctor and they said, okay, we're going to admit you. And I believe it was around like 12 hours-ish between when I entered the emergency room and when I actually was in a bed. That's pretty good. I have since had to deal with hospital wait times, and they are so much worse. You've got your antibiotics in your intravenous. They'll have just like hydration, so like saline solution or whatever. They'll normally have electrolytes. So that's sort of like a standard bag that they might hang on your IV thing. And there's also another kind, which is when, for whatever reason, you can't eat. And so they'll put another solution that has all of that. It has the electrolytes and the saline and whatever, but it also has dextrose. And dextrose is like a simple sugar that your body can take into the blood and then break down into energy. And so if you are not allowed to have anything by mouth, they call it NPO here. I don't know what they call it elsewhere, but NPO means like you can't have anything by mouth, not water, not anything. They don't want you to get dehydrated and they want you to starve to death. So they give you dextrose in your blood, and that acts as sort of like an energy or like a food source for you. When you have the dextrose in the intravenous, my experience is that you're not really hungry because like your body's getting nutrition. It's not like feeling deprived of anything. So it's not like giving you hunger pangs. And so I had everything I needed in the intravenous and I was fine. The only thing was that I had this infection and I was in pain. So they just had to treat my infection and they had to treat the pain. There's what they call a general surgical team or general surgery. I can't remember how they call it. They'll sort of have people who are assigned to you. So I had assigned to me a resident, and I think she had like another doctor overseeing her, but I mostly dealt with the resident. She was very, very young, but the surgeon was also really young. It was just like, oh, okay, this is Grey's Anatomy, like everyone was young. Everyone was very like thin and conventionally attractive, and it was really weird. It did kind of look like when they came up with their little clipboards and stuff, I felt like I was in Grey's Anatomy. It's my first morning. I'm in the hospital. They come and they meet me. They say, we're gonna have to treat this with antibiotics. Make sure that everything is working well, your white blood cells are down in the normal range before we can discharge you. And then presumably at that point, we'll be able to give you oral antibiotics and you can continue treatment at home and it'll clear up. Because normally, if it gets really bad, we have to do surgery and you are too fat for surgery. If we try to put you under with anesthetic, there's a good chance you're going to die. Because of the size of your body, we wouldn't be able to do this like life-changing or life-saving surgery if we needed to do it. So we have to treat it with antibiotics. This was not a great thing to hear. So I thought to myself, we must have good enough medicine that if somebody fat is dying, they don't just let them die. Like there has to be a way. Like if I had an enormous tumor and they had to get it out, would they just let me die? Like I can't believe that that's where medicine is at in 2024 at this time. Like I was completely floored that she would say that to me. That was the very first time that I met her. Over the next day or so, she came to see me and she said, you should know this is a disease that people get much, much older than you are. At the time, I was 40. She was telling me, people your age just don't get this. I knew that not to be true because my partner had had it a year prior. My partner is 2 years younger than me. So he was 37 when he had it, and I was 40 when I had it. I remembered that my partner had also said that there was this 25-year-old guy in the bed next to him who also had it. So I was just really confused. And she said, people your age don't get this, but because of your weight, I guess maybe that explains it. I was just kind of like floored. I said to myself, I just don't remember this discussion happening with my partner in the sense of like, you couldn't possibly have it unless there's something like fundamentally wrong with your body because my partner isn't fat like I am. I remember saying to her, well, that doesn't make sense though, because my partner had it. My partner's not my size. My partner's younger than I am. Why would this be related to me being fat? And this is me speculating. Of course, I don't live in her brain, but I think she might have felt like I'm on a mission and this is going poorly. Maybe I should switch tactics. That's sort of like the vibe I got. But I remember after that, she looked at my Rollator because I had my Rollator at that time. She looked at my Rollator and she said, why do you use that? And I said, oh, well, 1 year prior I had, I said I fell and broke my ankle. And so since then, I've been having kind of some mobility and like weakness issues. So I bring my Rollator around with me so that if I have a problem, I can sit down before I fall down. And it helps me to stay more active because otherwise I'm afraid I'm going to fall all the time. And like, I feel like I can't move around at all. She was like, oh, okay. I just, I was thinking, because if this gets really bad, like if it comes back or something, we can probably fix you up this time, but like sometimes it comes back. And I said, oh, okay. Yeah. Okay. And she says, if it gets so bad that like surgery would be the normal course of action, what are we going to do? And I kind of looked around and was like, I don't know, like you're the doctor, you tell me, And she says, well, what I would recommend is have you like tried anything to lose weight? I love when doctors ask me that because it's kind of like asking like, have you ever considered not being sick? Or like just the most like ridiculous, like, oh, hang on. Like there's this thing in my life that people latch onto and make my life difficult for. What would happen? Oh my God. Oh my God. What would happen if that thing wasn't in my life anymore? Like as though we've never had that thought, fat people. Like, it's hard not to laugh at them when they ask these questions. Like, have you ever considered losing weight? Like, I have been a fat woman for 40 years. You don't think I was considering losing weight as a child? It's absurd. Like, it's just such a, I don't know, like, I know they don't mean anything bad by it. Like, I know they're trying to help or they think they're being delicate or something, but it's just like the silliest question. And the truth is, like, my mother put me on my first diet when I was 8 years old. My entire life, I have been told that my body is wrong and people have tried to fix it. We know that diet and exercise is not a viable solution for most people to lose a meaningful amount of weight from their body. She asked this question. I just kind of looked at her and I said, well, yeah, obviously. I just remember her saying, well, what have you tried? And I said to her, I mean, what haven't I tried? And it wasn't even in the sense of like, please, I'm desperate, help me. Like, I wasn't even saying to her, can you please finally find the solution for me? That was not at all what I meant. I just sort of was saying like, what a silly question. Like, I've been fat for 40 years. I've tried a lot of things. Like, that's a long time to try things in a society that constantly tells you you're wrong for being the way you are. You're going to try a lot of things. Like, anyway, I was getting fed up with her and she said, okay, so have you considered bariatric surgery? I'm going to leave you there. Because I'm an asshole that way. Because that is where the conversation goes. It is so fascinating how that conversation came to be kind of the main discussion between me and the surgeon. So next time I'm going to talk about that discussion with the surgeon and the things that it led to, because it led to some really interesting things. Maybe not interesting in a positive way, and kind of how that did or did not resolve itself. It's going to be a good one. Thank you for watching, and till next time. Bye-bye for now.